My name is Norah Foster. I'm an orthopedic spine surgeon here at Premier. And today I'm going to be talking about awake spine surgery and all the great things it has to offer our patients. First, we'll start with kind of what is awake spine surgery. And I think this slide kind of depicts the picture that many patients think of when I mention to them, would you like to do your surgery awake? And that they're going to be having a scalpel in their hand and helping me do the surgery. And that's just not true. So this picture is actually a phenomenal example of, we can do surgery on ourselves, but that's not what I'm asking patients to do. So first we'll talk about what is awake spine surgery. So traditionally, spine surgery is done under a general anesthetic, and if you've ever had one, that means that we control your respiratory system. So there's a tube down your throat helping you breathe throughout the entire procedure. Awake surgery, on the other hand, is performed under a regional anesthetic, and in this example, it's a spinal anesthetic, and we'll talk more about what that is instead of a general anesthetic and why we might want to do that. During the procedure, you're given sedation, however, and that's adjusted to the desired effect so that if we need you to interact with us, you can. People sometimes will call it a twilight, and if you've ever had a colonoscopy, it's similar to the type of sedation you might get during that procedure. And it's a great option for some patients with definitely some significant benefits, and we'll talk more about which patients and what those benefits are. So first, to kind of walk you through, what would I experience if I had awake spine surgery? So in the preoperative holding area, it'd be very similar to any other patient who's going to have spine surgery. You'll be brought into the preoperative area. You're going to meet with the nurses. They'll check you in. You're going to meet your anesthesia team. So you meet your anesthesia team the morning of surgery, and then your surgeon comes and talks to you. So not a lot of differences between general and awake at that time point. And then we, meaning the anesthesia team, perform the spinal anesthetic. So they'll clean off your back, and they'll, using a small needle, go into the space around the spinal cord and spinal nerves, where they'll inject a local anesthetic or a numbing medicine that's going to give you pain control throughout the remainder of the procedure. After they do that, they take you to the operating room, and patients will ask, what am I going to feel during this? The vast majority of folks will tell me they don't remember any part of this. So you're in the operating room. We'll help roll you onto your belly, so you're laying on your belly, much like in the photo. Your face is going to have a very cushy kind of foam cushion underneath it. You'll be able to talk to the anesthesiologist or myself if need be. Your arms are kind of laying on padded arm boards, and you can be as comfortable as you would like to be. Some people want certain music, so oftentimes we play music in the operating room, and you can pick any particular kind of music you might like to listen to. We perform the surgery, and then you go to post-op, and you feel great. And then hopefully you either spend the night because you were planning to, or you go home. So it's very similar to all other spine surgeries. It's just the anesthetic is a little bit different. So why are we talking about it? Why would someone want to have an awake spine surgery? So we're going to need it. So lumbar degenerative changes are the leading cause of disability in the United States. It's the second most common reason someone's going to go to a physician's office, preceded only by the common cold. So there's a lot of them. As the U.S. population continues to age, we have more and more people over the age of 65. By 2030, they're predicting at least 20% of our population is going to be over the age of 65. So this is about to be a very large number of people who have these lumbar degenerative changes. And we as surgeons, we as the medical community have to continue to push to be better at what we do, to provide high quality, effective, and safe care to our patients. And for me, that happens to be spine surgery, so that's why I'm interested in it. So what are the benefits? There's increasing evidence against general anesthesia for older patients. So it can have cognitive effects. So particularly if someone has any kind of baseline cognitive dementia, they might be a good candidate for not having a general anesthesia. Doing a spinal anesthesia or awake surgery avoids having an endotracheal intubation, meaning that tube down your throat, with mechanical ventilation, meaning we help you breathe. So that puts less stress on your heart and your lungs as opposed to a general anesthesia. Additional benefit is it decreases postoperative nausea and vomiting. So some patients with anesthesia get significant postoperative nausea and vomiting, and this has the potential to decrease that because you're not getting the general anesthetic. Shorter length of stay, so if we can decrease how much wake-up time you have on the back end, you can potentially be in the hospital for a shorter period of time. If you're feeling better sooner, you get to go home sooner. Decrease blood loss. So these are surgeries that we're generally doing with minimally invasive techniques if available, and therefore losing less blood. You are better able to control your blood pressure sometimes than we are, so you may have less blood pressure in order to create additional blood loss. Decreased opioid use is a big one. So you're given sedation, but not given necessarily a lot of pain medications because the spinal anesthetic is controlling your pain for you. So we don't need to use nearly as many opioids in order to control your pain, which on the back end is a good thing. It means less tolerance, less side effects such as constipation, nausea, vomiting, and just in general, less opioids are better. And lastly, you can communicate with us during surgery if needed. So while you're in a sedated state, if we needed to decrease that sedation and needed to interact with you to make sure you remain comfortable, we can do that and you can provide us that feedback. So as with anything that has pros, there are obviously cons. So there are risks to absolutely everything we do. There are risks associated with surgery. But at the end of the day, we always want those risks and benefits to weigh each other out, and hopefully the benefits outweigh the risks. So certain risks associated with spinal anesthetic would be headache, nausea, vomiting, low blood pressure, effects on your hearing, neurological injury where we're interacting around the nerves, and then a spinal hematoma. These are very, very uncommon, but no procedure comes without risk. Why are we talking about this? And is a spinal anesthetic for spine surgery new? Is this a new invention? No, it's absolutely not. We've been using this process and this type of anesthetic for decades. If you've ever had any kind of other orthopedic surgery, many of them are done awake or with regional anesthesia. So hip fractures, carpal tunnel surgery, knee replacement surgeries, shoulder rotator cuff repair surgeries. These are oftentimes done with a regional anesthetic and sedation. So it's not a new procedure. Spine surgery, however, has taken longer to adopt and bring awake surgery to common practice. It's not even new to spine surgery, however. So the earliest paper I could find published on it was in 1959 at Henry Ford Hospital in Detroit. They looked at 1,000 patients, over 700 of which had a spinal anesthetic. And essentially their conclusion at the end of looking at all of these patients was that the spinal anesthetic was no worse than the general anesthetic, and it's a valuable tool that we can use in spine surgery. So why hasn't it become more prevalent? It's just about comfort level, and it's about patient care. So it's becoming more and more common as we start to understand the effects of general anesthesia on the human body over the past several decades. Which surgeries can we do awake? So there are several, and we'll talk about some of the limitations. So lumbar discectomy is a great surgery to do awake. Lumbar laminectomy, where we're taking pressure off of the nerves. SI joint fusion is another example. Spinal cord stimulators, and even lumbar fusion can all be done in the awake setting. Who's a good candidate? So these surgeries have to last less than about 3 to 4 hours. The spinal anesthetic lasts about 3 to 4 hours. So if we push past that time limit, you start to feel what we're doing, and obviously we don't want that. Patients like we talked about who may have some cognitive impairment or some early onset dementia, they'd be good candidates for a spinal anesthetic because we don't have to do a general. If you have a history of postoperative nausea and vomiting, this can absolutely decrease that. If you have a desire to use little to no opioids, so if you've had a prior history of using them with bad side effects, if for whatever reason you're recovering from drug abuse, this is a great opportunity to use as little as we possibly can. Heart and lung disease, that precludes the general anesthesia. So some people just don't have the metabolic reserve in order to undergo a general anesthesia. Oftentimes that's some of our sicker elderly patients. So this gives them an option whereby they can safely have surgery with as little risk as we can possibly use. And then lastly, patient interest. So a patient has to want to participate in this, and we'll talk more about why they would not want to. So who's not a good candidate? Surgery, like I mentioned, that takes more than 3 to 4 hours. If you take any kind of anticoagulation, they're injecting that anesthetic, that numbing medicine around your nerves. And if there's any local bleeding due to your anticoagulation, that can be a concern. So oftentimes we won't do it in patients who are anticoagulated. If we're worried about your respiratory system, so if you're obese, have COPD or obstructive sleep apnea, you may not be a good candidate for awake surgery because when you're lying down, we're worried about your airway and we can't necessarily access it very easily in a quick fashion. Patients who are alcoholics or have a low pain tolerance. Patients who have a high anesthesia tolerance. There's an associated with patients with red hair and high anesthesia tolerance. Probably most importantly are the last two, which is either if you have anxiety or you just have no interest in participating in an awake spine surgery. Some patients will say, knock me out, I don't want to have any recollection. And part of that comes from a misunderstanding of what awake spine surgery is, but it's not to say that that's not a valid reason. So if you find yourself anxious in certain situations or anxious around healthcare, or if you just have no desire to have an awake surgery, then you're not a great candidate for it. Why am I talking about this today? So I came here from another hospital in North Carolina about 4 years ago. At that hospital, we had an awake spine surgery program. And upon coming here, I started talking to my anesthesia colleagues about, is this something that we could bring to Miami Valley? Is this something that Premier Health would be interested in? And I have had the blessing of having very understanding and proactive anesthesia colleagues who said, absolutely, we can make this happen. So in 2022, myself and some former colleagues wrote how to start an awake spine surgery program at your hospital, kind of a how-to guide for hospitals. And I'm happy to announce that in January of 2023, we did our first awake spine surgery here at Miami Valley South. We have continued to recruit patients who want and are interested in awake spine surgery, as obviously there are a lot of benefits, and some patients would prefer to avoid a general anesthetic if possible. So I've been blessed to provide that patient care, and I've had great colleagues very supportive of it. In that vein, we continue to push the envelope, and we're constantly trying to figure out ways to do better. So, preceding my start here, we were using minimally invasive options. All of us do surgery as minimally invasive as we possibly can. But that's been around now for probably about 20 years or so. We have enhanced recovery programs. So those are called ERAS protocols. We use those for all of our spine surgery patients. So that is our standard practice that we have available to all patients. We've recently, like I said, in January 23, started awake spine surgery. So we're almost going up on our 2-year anniversary of offering this to patients. So continuing to push the envelope. Last week at Miami Valley South, we used a new imaging and navigation system. We're the first in the world to have purchased it and used it on patients. So we continue to make the environment better and safer for our patients. And then hopefully next on my agenda is to offer some endoscopic spine surgery to our patients. So perhaps a webinar in the future talking about what that looks like. So if you find yourself in the situation where you're thinking about spine surgery and you are indeed a candidate for awake surgery, I encourage you to reach out. We'd be happy to answer any questions you may have.